paranoia, yelling, mood swings, inappropriate sexual behavior, and physical aggression. Alzheimer's and dementia is increasing in prevalence over the years. The 2015 World Alzheimer Report stated that there were 46.8 million cases of dementia worldwide. Scary, Inez, and Scary state that this will nearly double every 20 years, meaning that in 2030 there will be 74.7 million cases, and in 2050 there will be 131.5 million cases. The same group said that 1/4 of patients in an acute hospital at any time have dementia or another cognitive disease. As a healthcare administration and gerontology student and a dementia caregiver, I feel that this is an important topic for healthcare workers today. Today I will explain why I think that dementia training should be mandatory for OHSU hospital workers. Whoops, that's not what I meant to do, actually. Okay, sorry. Dementia care is unique and challenging. One of the challenges is communication. Mid to late stages of dementia are no longer able to communicate clearly or no longer verbal at all. In addition, often they are unable to understand what is being said to them. Instead, behaviors communicate needs, and these, as I gave examples in the beginning, are usually undesirable and disruptive. People without dementia training often misunderstand these behaviors as just being disruptive. These behaviors also lead to dementia patients being over-medicated. Tricarico in 2017 said that haloperidol and risperidone are often prescribed to these patients, leading to half of the patients having new or worsened confusion. And again, this is troubling because behaviors are usually their only way to communicate. It's well known that caregiver demeanor has a big impact on patients, but this is especially true in dementia patients. Cassidy and Shake in 2002 and Magai, Cohen, and Gomberg in 2002 found that there's a direct impact on patient behavior. The demeanor of caregivers has a direct impact on patient behavior. Visser et al. In 2008 found that patient behavior is directly impacted by the care they receive. Bergener, Jurovic, Merle, and Barton in 1992 found that caregivers who were more relaxed resulted in dementia patients who were more cooperative and calm. Bergio et al. In 2002 found that the verbal quality of caregivers affected the occurrence of behaviors. I don't know why I keep wanting to flip my PowerPoint. Okay. It's sad, but studies show that dementia patients often receive poorer care than their non-demented counterparts. I've witnessed this firsthand working at a dementia care facility where new employees often give lower standards of care and experience more behaviors than the dementia patients. One example of this comes from Zachary et al. In 2008. Dementia patients had lower functional and nutritional status both at their admission and when they were discharged. Tricarico in 2017 studied Lewy body, dementia patients with Lewy bodies in particular, and said that they have an increased rate of complications, resulting in 32.6% transitioning to a higher level of care. Yatwa Liu, Lai, Dai Ting, and Choi had a survey in 2013 that found that patients and families with dementia are unsatisfied by their care in general. Another issue in dementia care is stressed healthcare workers. The behaviors that I mentioned earlier cause great amounts of stress in healthcare workers. Yatwa, Liu, Lai, Dai, Ting, and Choi in 2013 in a separate study found that 40% of physicians were more frustrated than rewarded by having patients with dementia, and 60% would rather have patients without dementia. They explained that their answers were because they had a lack of confidence and believed that only specialists should treat dementia patients. It's well known that an increase of stress decreases work outcome and decreases worker satisfaction. Another study by Yatwa Liu, Dai Ting, and Choi found that physicians with training were 87% of them felt confident treating dementia patients, 71% felt confident diagnosing and managing, and 74% felt that they could increase the quality of life for dementia patients. On the other hand, physicians without training, only 25 to 49% of these physicians agreed to having these skills. Okay, now that we've talked about current dementia care, let's talk about a possible solution. One possible solution is increasing education for healthcare workers. My first recommendation is implementing a class that would be created by training staff and dementia experts, which includes a post-test that would ensure that healthcare workers retain the information from the class. And before the class would be implemented, I recommend testing it with small groups and surveying them after. I believe this class should be mandatory, given annually, and that there should be a deadline and consequences if employees do not complete the class on time. We all know it's difficult to retain information from a class. Brain, Carlson, Kilgreen, and Norberg in 1989, and Edberg and Hallberg in 2001 found that education alone is ineffective at increasing patient outcomes, but education along with continued support is effective. Because of this, I recommend including a dementia information database for staff to access, again, developed by dementia experts, to be updated annually. So now that we have a solution in mind, let's talk about added potential benefits. So increased patient outcomes lead to increased hospital ratings. And considering that dementia patients are up to 25% of the acute hospital population at any one time, it's an important consideration to make. Increased hospital ratings lead to donors wanting to donate more money, students wanting to attend the university, and patients more likely to attend the hospital. Another benefit is the value-based purchasing program for Medicare and Medicaid. This program inspects hospitals and expects them to improve with time. They study safety, clinical care, efficiency, cost reduction, care coordination, including communication, and the general hospital rating, and award money based on this. So with all of these potential benefits, the hospital could have an increase in profit. To recap, dementia is challenging and important because it's increasing in prevalence. It's a unique disease that has led to poorer outcomes and stress in healthcare workers. My solution to this problem is implementing an education class and a dementia database for the healthcare workers at OHSU. I implore you to implement this or a similar program because incidents of dementia are increasing. In 30 years, over 131 million people will be looking for expert dementia care.